Subscribe to our YouTube channel and press the bell icon to get the latest updates.
I'm with Dr. Srinath Reddy, the President of the Public Health Foundation of India, and Priyanka Chaturvedi, the spokesperson of the Shiv Sena in Mumbai. We are connected across the country. Dr. Reddy is in Gurgaon, just outside Delhi, and Priyanka is in Mumbai. And the big question today is, how do we deal with this pandemic? It's come right inside our houses, not just inside our houses, but inside our colonies, in our communities, across the cities, and is moving furiously, is raging across tier 2 cities, tier 3 cities across the country. Mr. Reddy and Priyanka, welcome to the Print today.
Thank you so much.
So the first question to you, Dr. Reddy, is about the pandemic. How did we let our guard slip, and what should we do now?
I think our attitude started changing at the end of September, because by middle of September, our case count daily started coming down. And by end of September, our daily death count started coming down. Mm-hmm. And then when the descent followed absolutely steadily till early January, and even, for example, the tests that were being performed, the test positivity rates also started coming down. And there was a general feeling that we had seen the end of the pandemic. Then, of course, a large number of people started believing that we had acquired herd immunity, and not only in some parts of big cities, but all across the country.
But had we acquired herd immunity?
Not at all. No, that was a very illusory concept to begin with, for several reasons. Firstly, we do not know what the threshold of the herd immunity is for this particular virus. Initially, it was estimated to be anywhere between 60 to 80%. We still do not know. All we know that is in Brazil, in the province of Manaus, where 76% of the people tested positive for antibodies. The pandemic was still raging. The hospitals were still being crowded. There was still a large number of deaths. And that may be because antibodies themselves do not necessarily predict that there is established immunity. Particularly neutralizing antibodies or not, we do not know. They're just antibodies. How long they last, we do not know. And since many of the people with these antibodies were asymptomatic, it is possible that their viral exposure could have been very minimal, and immunity might be short-lasting. But far more important, and this is really necessary for people to understand, is that in any group of people, if let us say 60 to 70% acquire immunity either through the vaccine or through natural infection, the remaining 30% are protected because the virus passage is being blocked by those people who are immune. And the remaining 30% are provided the protective cordon. The moment they leave the protective cordon, they go to another part of the city, they go to another city or another country where the rates of exposure are only 20 to 30%. They're still very much exposed. So herd protection is an attribute of the population, not of the individual. So every individual has to acquire his or her own immunity, hopefully not through an infection, better through a vaccine.
Right. So Priyanka, unfortunately, Maharashtra, your state, is doing very badly. The pandemic is sort of come home to you in ways that you know better than anybody else. Why do you think it's so bad? And what is your government doing to protect its people?
So firstly, I'd like to thank Dr. Reddy for putting it so simply about the herd immunity, because it's extremely important to understand that. I remember when I tested for antibodies, I thought I had got it through herd immunity, but I was told that maybe you had an asymptomatic, and he's right, asymptomatic case of COVID positive, and you did not realize it, and that is how you managed to develop the herd immunity. So it's very important to know that we only end up safeguarding if there's a larger number of people with herd immunity. So help in safeguarding those 30% in a room of 100. But we are again exposed to the virus once we are out of those, those safer networks. As far as Maharashtra is concerned, all I'd like to say is that our data has been very transparent. Our testing numbers have been very high. The state also has a large amount of population, migratory population, as well as population of people coming from overseas to work here for business purposes, etc. due to which we have seen in terms of numbers, we have maintained transparency, and that is why you see what you see is what you get. And that is why we also, in fact, when you said we did not see the second wave coming, our chief minister has categorically been warning people about the second wave. We were criticized for, ensuring that we continue to safeguard our people, ensuring measures are put in place, ensuring that we continue to engage with people. But yes, many of the people let the guard down. We opened up businesses, we opened up flights, we opened up trains, the local trains, especially in Mumbai, which could have led to this, I would say, acceleration of the second wave. However, like Dr. Reddy was saying, that we are also concentrating on vaccinating more and more of our population. Maharashtra stands amongst one of those states which is leading the entire vaccination campaign. So it becomes imperative when we are being, the entire process is being regulated, monitored by the center, despite state being a health subject, then we need to also ensure that we get total cooperation from the center and there's no politics, because this is an apolitical, agnostic disease. It can afflict anybody. It is afflicting people in the BJP, in the Congress, Shiv Sena, anyone. So we have to look at it as a pandemic, not as a political pandemic for us to reap benefit out of. So when we were running short of vaccination, we spoke about it. But it's a good thing that today the government has made Sputnik available, as well as given permissions to other vaccines under emergency usage. So those are important things that we need to look at. We need to develop herd immunity because Maharashtra cannot be shut for long. We are, of course, talking about testing, tracing, and treating, and that is most important as well.
Right.
And also, last thing I'd like to mention here about the younger population. We must understand a large amount of our working population are those under 45 years of age. I've been speaking to many chambers of commerce in Maharashtra. Many people say that, we cannot take benefit of the vaccination because 80% of our people are below 45 years of age. So we also need to understand that these people who are traveling the most, who are stepping out of their homes, can go back home and infect their senior citizens in their houses as well without realizing it. Like, for example, I was asymptomatic, but I was masked up all the time. So you also need to understand that you need to be, you do not need to let your guard down and ensure that masking, tracing, tracking, and treating people is most important.
So, Dr. Reddy, we are not going to indulge in a blame game here, of course. Now, Maharashtra has reported the highest number of cases in the country. But my question to you is, if you're looking at the science, what is it that Maharashtra could have done better? Because at one point of time, it did seem as if things were coming under control. So what is it that Maharashtra can do even today?
I would say Maharashtra actually had a greater vulnerability than most other Indian states to begin with.
Why is that?
Both in the first wave and in the second wave. Mm-hmm. Firstly, it is one of the most urbanized states. It's one of the most industrialized states. And you have a huge urban crowd density and a lot of transport networks which bring in people in and out of the state, a lot of mobility. And we see this everywhere in the world. So whether it is Los Angeles or New York, it is the big cities that get affected much more. Mm-hmm. And we have Maharashtra with some of the largest urban congregations. Even among the top 20 of the urban congregations in India, I think Maharashtra is 5 or 6. So we have to expect this to happen in Maharashtra. And even in highly industrialized settings, leave aside the urban slums, where people have to work crowded together in a factory floor, there is much greater chance of transmission. So Maharashtra's vulnerability existed, but also when you are seeing that the virus enters essentially from international travelers to begin with in 2020, and the mutants or the variants have also come in from international travelers. Though, of course, the double mutant could have evolved in India as well. But we notice that there's a much greater opportunity to come in through the large international airports with multiple flights. And then you spread in the city and in the surrounding districts. So we have to recognize Maharashtra was vulnerable and is vulnerable even now. But I think one of the things that we could have and should have done is to prevent large gatherings other than for work, and even there insisting on masks, particularly indoor congregations for meetings or work. Masks were absolutely necessary because that's where the virus can easily move from person to person, and even outdoor as well. if we have been, and not just Maharashtra, all over India, particularly in the cities, been more careful in ensuring that people got the message on the masks and avoid crowding, then we could have actually managed to escape with much lower number of cases than we are seeing now.
So Priyanka, perhaps your public communication strategy could have been better. I mean, with all the factors that Dr. Reddy just talked about, and you have too, which is large populations, concentrated populations, but people need to go to work. Now, is your government looking at a lockdown? Do you think that's the answer? Or perhaps, better strategies to communicate the fact that you need to mask up, and now just not one mask, but perhaps two?
So a couple of things I'd like to mention here, Jyoti. Even in the USA, I'm sure many other states had a higher caseload vis-a-vis those states which did not see a caseload. Like California had a higher caseload. Maybe some places in East Coast did not have such a high caseload. Or European nations are having a high caseload. Brazil has a high caseload. So it also has to do, like he said, about mobility. But I did not see USA coming out and saying, because they have these independent strategies and they encourage independent strategies, come forward and say, hey, listen, California is reporting more numbers while the other state is not, because they are better governed while you're not. We need to get over this. Firstly, this entire idea of accusing a state government, accusing governments, accusing some states, we need to get over this because this pandemic is real. In fact, our central government did not even see the second wave coming in this pandemic. While we were going on, our chief minister was talking about it. Now, in terms of communication, let me tell you, the state government's focus has categorically been to mask up, sanitize, and maintain social distancing. All over the state, you would find hoardings which encourage that. Chief Minister continues to speak that. Chief Minister keeps his politics aside but continues to talk about how there is a second wave coming and we should not let our guard down. Then he brings in an entire initiative which talks about my family, my responsibility. We're telling the family members that, listen, your families will become your responsibility, and when they step out, it is your responsibility to ensure that we are breaking the chain. Now we started with me, I am responsible for myself, and I'm responsible for the communities I'm living in. So those are initiatives that we have taken in the state.
When you walk in the city, or when you travel in the city, do you see that people are masked up? Because that's a lot of people are not masking themselves.
No, they are not. I mean,
the message hasn't percolated down.
No, I do agree. But the messaging, if you look, here's my question to you. We are living in a very interconnected nation. Everybody has a mobile phone. On one hand, you have a health minister of another state saying there is no COVID, you don't need to mask up. Then you see these huge election congregations happening across the length and breadth of this country. And we continue to maintain that in the state that, listen, we cannot, let our guard down. But they are seeing the entire country has opened up, and then the criticism begins that why is Maharashtra not doing enough? So we need to understand that there's only so much a state government can do, communicating. I think they have been communicating non-stop, have been reaching out in terms of, ramping up their infrastructure. When the first lockdown happened, you're not seeing those troublesome videos that are coming out from other states, which need to show that they're doing a great job, but unfortunately are not reporting the right numbers or the right deaths. I'm not going to get into this. But yes, we also agree lockdown is not the answer. However,
so you're not planning to lock down?
No, that is a decision that the group of ministers will take. I'm one of the members of parliament. I'm not involved in that day-to-day running of the state. It will be a decision taken by the group of ministers, our task force. Neither am an expert in this field to be able to take that call. However, the state government understands the urgency. We also understand that this second wave has hit harder than the first. All other states are also reporting equally high numbers, which had not been breached earlier, but are breaching now. So we need to break that chain. How do we break the chain? Either people cooperate and, which the chief minister kept saying, that we mask up, maintain social distance and avoid travel if we do not have urgent work to do. So we put some measures in place. Weekend lockdown has happened. We have seen it has been slightly effective. But we'd hope there is no lockdown and there's less of the stringent measures. But if there is no other option, we would not hesitate in keeping lives over livelihood above everything else. For us, the people of the state matter, and we need to keep that in mind.
So 2 questions to you, Dr. Reddy. The first is that, Priyanka's point about large gatherings, now whether we have elections in Assam or West Bengal or Tamil Nadu and Puducherry, or the Kumbh Mela, the Shahi Snan, the bathing of, thousands and thousands of devotees that are taking place. Now, can you make a connection between these large gatherings, whether it's religious or political, with the COVID or with the second or third COVID wave? You know, after all, if somebody would say that, what does the Shahi Snan at the Kumbh Mela have to do with Maharashtra's numbers? So, is there a link?
Well, firstly, any large gathering, indoor or outdoor, but especially indoor, can be a high problem for transmission of the virus. It makes it very easy for person-to-person transmission because viral clouds hang around in indoor areas. Even outdoor, if people are static or moving very slowly, bunched up together, then again the virus gets a good chance. It's only when they're walking briskly in open air that they are likely to be more protected.
But
So,
Dr. Reddy, if there is a large gathering in Bengal, what does that got to do with Maharashtra's numbers? I'm asking, can you make a link or not? Or is it two different things?
I cannot really link a particular event in Bengal or UP or Hardwar or wherever for what is happening in Maharashtra. However, there are two things. One is if people are traveling to and from those locations, they can bring back viruses. The second, of course, is that seeing such scenes is also likely to encourage people to be much more lax in their behavior anywhere in India. Because that kind of behavior is communicable, whether the virus is communicable immediately or not.
Okay, so and my second question to you is vaccination. Is mass vaccination the answer to this?
Well, let's get the point about what is the utility of vaccines immediately, and then look at vaccines in the longer term. The benefit of these vaccines, which are currently available, which are intramuscular vaccines, which produce systemic immunity, is not to prevent infection per se, but to fight the virus once it has come into your body from causing severe disease or death. And therefore, people who are highly vulnerable are to be protected first. People who are performing absolutely essential functions need to be protected first. Now, does it stop transmission if large number of people are vaccinated? Over time, yes, it will. Because even if they get a mild illness, the amount of virus they're going to be discharging into the environment through cough and sneezing is going to be much less. But that's a slightly delayed benefit. Because right now, the trials have really not been done to find out how much the transmission is reduced. It is only in Israel, a relatively small country, where extensive vaccination has been done, where they're suggesting that even transmission rates have come down. I too believe it will come down. But if the vaccine supply is limited, our first priority is to vaccinate the people who are most vulnerable in terms of severe disease. As far as the transmission from younger people is concerned, if they actually are going to be mindful of wearing masks, even while they're indoor, while meeting the elders, then they're unlikely to be actually transmitting the virus. Yes, if enough vaccines are available, and I hope they will be, then even younger people must be vaccinated. There's no doubt about it.
Right.
And even now, younger people who have already comorbidities must also be given the vaccine along with the age group that is defined. Right. So over a period of time, we do require much more extensive vaccination. But in the meanwhile, we have to prioritize on the basis of vulnerability.
Right. So before I come to you, Priyanka, Dr. Reddy, another question about the vaccine. India just approved a third vaccine, which is the Russian Sputnik vaccine. Now, do you think that India should have, because we have such a large population and the numbers are large, many more people need to be vaccinated. So does it make sense to import, 4 or 5 or 6 vaccines? Or is there some sort of I don't know, is there a clash of vaccines or some, how does that work?
Well, they have actually just announced that as well. I mean, apart from the fact that they have given approval for the Russian vaccine, which I believe is going to have 850 million doses produced this year. Firstly, the first lot is going to be imported from Russia by Dr. Reddy Labs in Hyderabad. And the 6 other manufacturers are going to be licensed for producing the vaccine in India. Now, much of it is actually meant for international export. However, now the government of India might exercise its rights to retain part of that here. And that is a negotiation that we need to watch. But in addition, just a few hours ago, the government of India has decided, and wisely so, that any other vaccine that has already been approved by a credible international regulator in UK, US, Japan, or Europe, or WHO can be actually started in terms of administration, and they will monitor the so-called bridging trial after the vaccination program starts, not before. So I think we are going to now see many more vaccines becoming available for public use. The quantity, however, may vary depending upon the international demand and supply situation, but the gates are now being flung wide open for many more vaccines to come in.
So Priyanka, is your government, there was some talk that you didn't have enough vaccines. Have you asked for more vaccines from the center? Are you getting more vaccines? Are you satisfied with that?
So a couple of things. When I meant to say that, they see images from other election going states with a large number of population coming forward. The behavior amongst us own is not because of travel that happens, it's also because, listen, everything is normal. Why can't we be normal? Nobody is masked up. Why is the need for Maharashtra to keep asking us to stay masked up? So there's a behavioral pattern to it. And then there's also accusation that the state government is being very strict about it and levying, fines, etc. for not masking up. So those
are you levying fines for not masking up?
Yes, of course we are. Of course we are. Okay. And we are very strict about it. BMC has collected quite a bit of fines, which we don't want to, but we are forced to because people don't adhere to norms. And that is something that will have to come from citizens and residents of the state and the city to ensure that they follow the norms to keep others safe as well as themselves.
Right.
Now, with regards to what happened in Maharashtra, I think this entire politicization of a simple request going from the state government, it started with the chief minister requesting the prime minister that here's where a vaccination drive could suffer if we don't get X amount of vaccine doses to be able to continue with the vaccination ramp up. So we need so many doses, and also because we see there's a large working population of the young, maybe you should universalize the vaccine and anyone above 25 years of age should get a vaccine.
They don't have enough vaccines, Priyanka.
Please allow me to complete. Yeah, just allow me to complete. Yes, we don't have enough vaccines. We got some 1.04 crore vaccines. We have vaccinated about 1 crore people. Our vaccine wastage has been less than the national average. We are at 3.2%. And we have, like I said, covered a large amount of population. Whether we have covered above 45 with comorbidities, 45 without comorbidities, healthcare workers, or the frontline workers, we have covered them all. We must also remember, this is a voluntary vaccine campaign. This is not something which every single resident has been asked to get vaccinated. So even in the voluntary drive, we have managed to cover a large amount of our population. Lots of our districts had run out of vaccines because of the pace at which we were doing it. That's why the chief minister requested for more vaccines. And so scientific need, want, as well as scientific strategy, if anyone uses their minds, would tell you this is a logical ask. That considering we are doing this at a ramped up
did you get your vaccines? Have you got?
So we have been. So we had asked for. Our chief minister had asked for 1.5 crore vaccine doses. What we've got is some 17 lakhs. Not got as yet. We have been promised that they are in the pipeline. It began with 7.5 lakh in the pipeline. When we ramped it up to 5 lakh people getting vaccinated every day, it would have lasted another 1.5 days. They have ramped it up to 17.5 lakh, but that is again in the pipeline. Not all has been received, but some of that commitment has been received, and hence we are continuing with the vaccination drive, but rationing our vaccines simply because we don't have enough in stock then. So we have to continue to ramp up only when we are assured of a non-stop supply and not political responses to how we are managing our entire vaccine strategy or the COVID strategy.
Right.
Which the health minister unfortunately chose to do.
So Dr. Reddy, we're looking at the science, and if states like Maharashtra are running out of vaccines, I mean, just not Maharashtra, I'm sure other states in the country are also running out, which is perhaps one of the reasons why Sputnik was given its emergency use authorization. But the question is that if you have so many vaccines in the market, will there be a problem with, say, using one vaccine or the other? Can I take the Covishield the first time and then the Sputnik and the second dose? How does it work?
Well, basically, I think it is for the government to decide on the policy there, whether some of the second doses are exchangeable or not. Mm-hmm. And the government, in its own system, is likely to follow that the first and second dose should be identical.
Okay.
However, having seen what is happening with Covishield elsewhere in the world, where younger people are being advised not to take the Covishield.
We're talking about the clotting.
Because of the clotting, it's possible those guidelines also could change. And interestingly, at one point in time, AstraZeneca wanted to do a trial with the Russian vaccine, giving the first shot with AstraZeneca and second shot with the Russian vaccine. They didn't go ahead with it, but perhaps we might actually end up doing that trial in practical terms in India. But it's possible that you could still use, because both are virus vector vaccines. So, and they are both using, one uses a chimpanzee adenovirus, the other uses human adenoviruses. So
Which one uses which? Which one uses which, Dr. Reddy? Which one uses the chimpanzee and which one uses the human?
Well, AstraZeneca uses the chimpanzee adenovirus as the carrier virus for the spike protein code, whereas the Russians use two different human adenoviruses, one for the first dose and one for the second dose. That's a smart thing to do, because even though the human adenovirus is innocuous, they theorized that once you give the first shot, for the second shot, the carrier adenovirus also may be rejected by the body, which might have developed immunity to that virus. So it may not be able to deliver the payload. So for the second dose, they're using a different carrier virus. Mm-hmm. So in that sense, it's a smarter move. And that strategy may work both for the Russian vaccines, 2 doses, or if they want to combine it, 1 dose AstraZeneca, 1 dose Russian vaccine.
And my last question to you, Dr. Reddy, is do you think states like Maharashtra or Punjab or Delhi or anyone else, should they be able to buy vaccines privately? So for example, if Maharashtra wants to directly approach Sputnik and say, okay, I'd like to buy X number of vaccines, how do you think this works in a country which is, where the virus is sort of rampaging through?
Well, initially, I was opposed to the private sector buying the vaccines directly, because that would cause a huge iniquity. But if state governments want to purchase from international manufacturers directly, I think they should be allowed to prioritize and purchase, because I think the more we decentralize at this point in time, the better it is. And that will help some of the states with a much larger burden. And as I said, with a greater risk because of the population density, to address their needs as fast as possible. But they should not compete so much with each other that they're going to be jeopardizing the national immunization agenda. So they'll have to tread a little carefully in concert with other states. But I think a certain amount of decentralization is perfectly appropriate.
Priyanka, has your government thought about this? Is that, approaching directly outside players, whether it's the Russians or the
I'm sure I'll give another reason for Dr. Reddy to concur with me. But this was my first request to the health minister, and absolutely apolitical in nature. It was a suggestion and feedback that maybe we would want that the center decentralizes it. Let the center take that initiative, so then the state governments also can feel free to place those orders, or for the if private hospitals sooner or later also can do it, if we put a cap to the pricing, which has happened. So if we can decentralize this further and allow the states to procure on the basis of
wouldn't it become like a free-for-all? I'm just a bit worried in a country.
Let it come from this. That is what I'm saying. Let the initiative come from the center, whether it is international vaccines or national vaccines. Let the need come from the center to decentralize up to a limit. I would not say open up the entire market, but take those baby steps to ensure that those states who need some more help, where the central government cannot provide more than X number of vaccines, so they can cover the need that they have by procuring more of those.
So then how would it work? So Dr. Reddy, how would it work? Would Maharashtra, for example, have to apply to the center to say, I need, say 10 lakh vaccines or 1 million doses, and then the center would buy on behalf of Maharashtra? Is that how it would be?
Well, I think the price ideally is best negotiated by one purchaser on behalf of all the others. But let's put it this way, only theoretically speculating.
Sure.
That as far as vaccines being manufactured in India, let the government of India decide how the vaccine should be procured and priced and distributed. But if a state wants to purchase directly from an international manufacturer, which is already for an approved vaccine, and spend its own money to do that, I think they should be permitted to do that if it feels the need and urgency.
So essentially, your message is that at this time of the pandemic, at this moment, the government has to decentralize across the country and let states take a decision of how they want to deal with this ways.
No, I'm not pleading for anarchy.
No, absolutely.
I'm asking for a method in which the center does provide the overall governance. But I think the states ought to be able to state the requirements, try and get their fair share, each state, from within whatever is being negotiated by the center. But if they, over and above that, wish to purchase from the international market from their own resources because they feel there is a sense of urgency, I think they should be permitted to do that as long as the vaccine is an approved vaccine.
So Priyanka, you have the last word, but I want to ask you about this tension over the last few days between your government, between the state government and the center. Have you both tided over this, at least for the moment, because lives are at stake?
No.
Things are not going so well. What's the situation now?
Our chief minister from day one has been very clear that we have to keep our political differences aside and work along with the center in total spirit of cooperation. And the very next day after this entire political statement that came from the health minister, the chief ministers had a meeting with the prime minister, online meeting with the prime minister, and our chief minister was very categorical, where he said, listen, we have been cooperating in every way possible, whether we got lesser N95 masks or we got lesser PPE kits, lesser ventilators, we haven't gone into making a hue and cry about it. But as far as vaccine was concerned, we did it in all faith. For it to become political was unfortunate and it should be curbed. And I think the prime minister stepped in and ensured that no political statements come from the health minister again, or for that matter, the entire cabinet, which went hand in glove with the health minister in making this political. So no space for vaccine politics at a time when we are seeing large numbers of COVID positive cases and record-breaking numbers coming from various other states besides Maharashtra as well.
Right. Thank you so much, Priyanka Chaturvedi. You're absolutely right. There's no place for politics, especially when you're dealing with a pandemic. And Dr. Reddy, thank you so much for explaining the science behind this and what India and what all of us as citizens can do to deal with this horrendous wave that is upon us. Thank you both for joining the print.
Thank you.
Thank you so much.